Good morning, everyone. Distinguished Chief Guest, Honorable Union Minister of Road Transport and Highways and MSMEs, Shri Nitin Gadkari ji, Honorable Minister of Communications and Electronics and Information Technology, Shri Ravi Shankar Prasad ji, guests of honor including Honorable Minister of State for Panchayat Raj, Agriculture and Farmers Welfare, Shri Purushottam Rupala, Shri Honorable Minister for Agriculture, Cooperation and Marketing, Government of Andhra Pradesh, Shri Kursala Kannababu, Honorable Minister for Information Technology, Revenue, Labour and Employment, Government of Goa, Srimati Jennifer Monserrati, Chairman, Telecom Regulatory Authority of India, Shri R.S. Sharma ji, and distinguished speakers and delegates and my dear friends. Thanks to Economic Times for having me here in this National Governance Virtual Summit. The theme of the summit, the continuity of public services in the time of pandemic, is a very apt and timely theme when the governments across the world are putting their best foot forward to mitigate the pandemic and also reboot the economy that had almost come to a halt due to lockdown. This summit is a great platform to bring together policymakers, industry leaders, experts together under one roof and brainstorm new ideas and solutions that can help government fight this pandemic and restore normalcy in the lives of people. I appreciate Economic Times for this great initiative. Being a doctor myself and now a minister who is in charge of the COVID in Karnataka state, I understand the double challenge posed by this pandemic. We are fortunate to have a leader like our Honorable Prime Minister, Shri Narendra Modi ji, during these challenging and tough times, and the way India has handled both healthcare response and economic management has made the whole world look at India with awe and appreciation. In line with Prime Minister's vision of Jaan Bhi, Jahan Bhi, Karnataka has been a success story in this fight against pandemic, saving both lives and livelihoods. We were the first state to curb and lift the lockdown and restart the economy. This was possible because of the stringent implementation of lockdown and effective implementation of 5T strategy with a great teamwork under the leadership of Honorable Chief Minister Shri B.S. Yediyurappa ji. In Karnataka, we have leveraged technology extensively in this fight against COVID-19. Be it training thousands of corona warriors, using tele-ICU to improve recovery rate, without stressing our healthcare system, or integrating various departments in our war room, Karnataka has pioneered technology like no other. We launched the online training with a SOP for doctors and healthcare professionals across the state. This helped to train more than 2 lakh corona warriors in a quick time. The Special Tele-ICU Patients Monitoring Task Force, a first of its kind initiative in the country, has ensured that specialist doctors can monitor and attend to but aren't exposed to any risks. This has been an effective tool in keeping the mortality rate low and increasing recovery without stressing the healthcare system. The technologies in the dedicated COVID-19 war room have enabled the integration of the health department with our police, hospitals, surveillance teams, ASHA workers, and Bangalore Water Supply and Sewerage Board. Interactive screens in the war room have been used for mapping of each COVID case, positive and suspected, using geographical information system. There will be a fundamental change in how things work and new business models, supply chains and mechanisms will come into being. Public services are no exception, and the way governments deliver public services will also undergo a lot of changes. Digital transformation has already become the new governance paradigm. Digital India had put the nation state on the path of being paperless, faceless, and cashless. And now this has been coupled with an urgent need of being contactless too. Digitization can help bypass the vulnerabilities India faces in crises like the present pandemic. Karnataka soon will have a state health registry which will be a repository of health data of all our citizens. Governments often lack the financial and human resource capabilities to quickly and efficiently develop digital tools that can support people during a crisis situation. Therefore, building partnerships with private technology companies, social entrepreneurs, or other national and international organizations can be an effective way for the governments to make use of existing technologies to meet the needs of people and soften the impact of the crisis on their lives. Accelerating the implementation of innovative digital technology is the key. Since the crisis has put public services under severe stress, governments are urged to deploy effective digital technologies to contain the outbreak. The crisis has demonstrated the need for government leadership in the development of adoption of new technologies such as artificial intelligence and robotics to ensure an effective provision of public services. AI-powered technology has proven to be beneficial for the provision of healthcare services when emergency lines outpaced capacity. During the outbreak, many people have turned to self-checks for symptoms and assessed virtual doctors through telemedicine to get medical advice. Multilingual chatbots offered solutions can help overcome language barriers in a diverse country like ours in assessing information and communicating with health practitioners. Robots and drones can be effective in providing security and sanitation, thus reducing staff exposure to the risk. Patrol robots using facial recognition and thermal cameras can be deployed at airports and public places to scan crowds and identify potentially infected people. Sterilization robots equipped with ultraviolet lights can be helpful to disinfect hospitals and contaminated areas. Robots can also be helpful in monitoring vital parameters from medical devices or allow patients to communicate remotely with the nurses. Drones also can be helpful to monitor streets, deliver medical supplies, or disinfect public spaces. The efforts in developing digital government strategies after the COVID-19 crisis should focus on improving data protection and digital inclusion policies, as well as on strengthening the policy and technical capabilities of public institutions. Even though the public-private partnerships are essential for implementing innovative technologies, government leadership, strong institutions, and effective public policies are crucial to tailor digital solutions to countries which need as well as prioritize security, equity, and the protection of people's rights. The COVID-19 pandemic has emphasized the importance of technology, but also the pivotal role of an effective, inclusive and accountable government. Effective public-private partnerships through sharing technologies, expertise and tools can support governments in restarting the economy and rebuilding the societies. In the long term, governments need to accelerate the implementation of innovative digital technologies such as AI powered technology, blockchain, and drones. Investments in these technologies can tremendously support the future resilience of the health economy and the public services delivery. I would like to conclude by thanking all the healthcare professionals and frontline corona warriors for their selfless service during these difficult times. I am confident that India will overcome this pandemic and emerge as a strong, vibrant, and self-reliant economy. I would like to thank Economic Times for the great opportunity. Thank you.